It's going to be on page 232. It's an ERS Right of T8 on T9. We're going to see, of course, we're starting out in the same way. The patient is going to be sitting there. You're going to come around as the operator. The only difference here is because you're working lower in the thoracic spine, you'll see in figure 1423 that he comes around with his arm and holds onto the shoulder. This is going to be for his ability and control to control the side bending and translation. But again, the palpation is going to be the same as you did with the other one. You're going to palpate for the interspace, go for the transverse process. No. And then we're always going to go until the barriers engage from anterior to posterior translation. Again, the biggest one that we have to be careful of is when we're treating the FRS, which is coming up. And we always want to kind of clear and gap the joint a bit so that that FRS returns more comfortably. With the ERS, it's a little more straightforward. You're trying to get it to open. There's a little less involvement in the treatment of that, but still steps that we have to go through. So let me have somebody up here, Lauren. Great. You can sit here. So if it's an ERS on the right, you're going to stand to the left of your patient. I'm just going to sweep this table. Yeah, no. Not yet. You want to have their, again, feet firmly supported so they don't feel like they're falling forward when you're having them. Okay? So, where are we now? T8-9. So, inferior angle, looking right about here. We know that at T8, we've got that rule of threes that we have to think of. 1 through 3, 4 through 6, 7 through 8. It's full level. So right about here, I'm going to have to get the transverse process just one full level above on the right.
Is this the one where he monitors on the other side instead of the side that you're opening up? This is the one he's monitoring on the other side.
We did the same thing with the ERS in the upper thoracic spine. We monitored on the left side.
No, we were opening it like this is
right.
monitoring on the right, but we're still opening. Which is this now? This is a
ERS.
ERS.
Right.
Right.
Remember, we always had a problem with that.
I'll double check the one. I think what you're thinking of is maybe the FRS.
Maybe.
So what we want to do here is make our palpation interspace transverse process, because what we want to do is we want to take note of the transverse process moving away from our finger. And the way that we're going to do that, I learned it a little differently. I learned that you never hold your patient's hand, but in the picture it shows that you're holding the patient's hand. Okay, what we're going to do first is an extended lesion and it's rotated to the right because it's an ERS right. What do we need to do first to fix the extension lesion? We need to do what? Flex. How can I flex? I can flex her all the way down like this. Or, just slouch for me a little bit. Boom, that's it. Okay, she's over her base of support. She's stable, local, she's not going anywhere. That's the whole purpose of either flexing from the bottom up or from the top down. Keep them over their base of support so they remain balanced. Now, what I can do to help with the side bending towards the right, to the left, sorry, is merely translate right. And when I do that with my axilla, look how easy that is. I could essentially do it without even holding on to the shoulder. That's your axillary contact, and that comes into play very good here. Okay? So, I flex, and I translate to the left, which means I translate to the right, which means I'm side bending left. Right rotation is going to couple with that. And now all I do is ask her to gently try to side bend to the right. I block her with my axilla. Relax. 3, 4, up, 2, 3. Further flexor. Translator right, causing side bend left and rotation left. Again, try to side bend right, Hold, 2, 3, 4, 5, 6. Relax, 2, 3. Relocalize. That's it. And the whole treatment, she stays over her base of support. What do I do now? I go back and assess for movement. Come back to the level. The problematic motion is going to be flexion, but I start in neutral. Symmetric and neutral, flex. And she's symmetric. So we've now corrected the ERS to the right. All right.